Welcome, everybody. Good morning. I won't bang the gavel, but I do have one. Yay! Now, I'll just get the mic. I talk kind of quiet, but I don't want to be totally on top of it here. So good morning, everybody, and I now declare the 99th annual meeting of the Nurses Association of New Brunswick to order. 99 years, what a history. Brenda, next year we'll get to celebrate our 100th, our centennial year, so of course we're all looking forward to that, and hopefully you'll all be at next year's annual meeting as well. I'm pleased to introduce the head table. Well, maybe I better lower it a bit. To my left is Barb Shellian, President-elect of the Canadian Nurses Association. Next to her is Roxanne Tarzan, our Executive Director, and Brenda Kinney, President-elect. I'm also pleased to introduce the Board of Directors of the Nurses Association of New Brunswick. Please stand as I call your name, and I would ask that you hold your applause until the end. President-elect, I've already introduced Brenda Kinney. Our region directors, Joanne, not good to leave. They know me at work that I'm clumsy. I was really glad when we switched from glass bottles to plastic. It was better for the patients and for myself. So Region 1, Joanne LeBlanc-Chasson. Jillian Ring from Region 2. Amy McLeod, Region 3. Therese Thompson, Region 5. Annie Boudreau, Region 6. Lisa Kierstead Johnson, Region 7. Jose Susi from Region 4 was unable to be here today, but she is our Region 4 Director. And our public directors, Edward Dubé, Fernand Chouinard, and Wayne Trail. Ladies and gentlemen, your Board of Directors. I'd also like to introduce the nursing students joining us today. I introduced myself to a few of them. I'm so excited to have them here. NANB implemented an initiative to expose our future registered nurses to their professional regulatory body by sponsoring 2 students from each program site across the province. Please stand to be acknowledged by your future peers. We are pleased to have you with us and look forward to your participation in the years to come. There will be a lunch session today for the nursing students entitled Teamwork Matters, Dialogue with Nursing Students. This session will be held in the Victoria Room and it's on the mezzanine floor. So again, thank you very much. So pleased to have you here. Bringing greetings from the Canadian Nurses Association is Barb Shellian, President-elect of the Canadian Nurses Association. Barb began her term as President-elect of CNA in June of 2014. Please join me in welcoming Barb Shellian.
Good morning. Bonjour, mes collègues.
Good morning, colleagues.
A pleasure for me to be here with you this morning in beautiful Fredericton, and a few of us were just commenting on, though I live in Alberta, I grew up in Saskatchewan, but coming to Atlantic Canada always feels like, did I just lose my mic? Always feels like you're coming home, because people are just so darn friendly. So you have that reputation of making people feel welcome, and I'm really, really pleased to be here. I want to first of all commend the NANB Board of Directors that you've just met, and specifically your President, Darlene Cogswell, and Executive Director, Roxanne Tarzan, and all the staff for being dedicated advocates for better health through the power of nursing. You need to be really exceptionally proud of your nursing leadership in New Brunswick. And when you think back about the nurses that have come from this province, Judith Olton, Lucille Offrey, Roxanne Tarzan, Darlene, people who have really made a difference. And so Canada is very proud of the nurses from New Brunswick. And thank you for coming today. I know for some of you it's an effort to be able to come today. Some people were not able to come because of work and other meetings that were happening. But your involvement in the professional association says something about you, but it also says that you're willing to be part of the bigger picture, part of the work that is past your unit, your health authority, your province, and being included in what's happening at the national level through CNA. Soon, and you'll notice some very nice looking New Brunswick people in this picture here, but just to let you know, and you all know that soon we're going to have an opportunity for to be involved in some major change. And we know that on or before October 19th, Canada will have a federal election. CNA, because it is the National Nursing Association and the voice of professional nursing in Canada, began its work related to the federal election in November of last year with our annual day on Parliament Hill, and Darlene was involved in that. And since that day on Parliament Hill, CNA staff, board members, and the officers of CNA have had more than 70 meetings with federal politicians, senators, and parliamentary staff. And I need to tell you that this is the first time in CNA history that all 4 leaders of the federal political parties have met with CNA, 3 of them at their request for repeat meetings. The officers of CNA and CNA staff have been to the Prime Minister's office 4 times since November, 3 times at the Prime Minister's office request. So I think what's happening and what's changing is it's what I call reverse door knocking, because when before, and for those of you who've been involved in political lobbies, when you go and you knock on the door, can we have a meeting, can we knock on the door, and you try to get an appointment, the reverse has happened where CNA is being approached and we're being asked, why are nurses so upset about the Safe Communities Act? Or what do nurses think about a senior strategy for Canada? And being asked those questions, and I think that is a very, very good sign that the process has changed. And the lobby that happened in November was less of a scattergun approach. Not that I'm going to pick on the docs, but I'm going to do it anyways, because their strategy is a seniors strategy, a seniors care strategy for Canada. Well, that sounds all good, but the first thing the politicians will ask you is, what does that mean? What? Like how? And CNA took a different approach in terms of being very targeted and say to the federal politicians, we know that the majority of the administration of health resources falls within the provincial jurisdictions, but here's 3 things that the federal government can do related to seniors' care. And the 3 things were, the first one, establish standards for home care. We know that if we go to a hospital in Fredericton or a hospital in Regina, Saskatchewan, or Canmore, Alberta, or Kamloops, BC, essentially as Canadians, we have an idea of what to expect from hospital care because there are certain standards across the country for hospital care. But we also know that home care is very different in the different provinces and jurisdictions, and we're asking the federal government to establish some standards so that the level of expectation can be standard related to those services. We also asked for, and specifically asked for, the tax credit for people who are caring for elders at home to be a refundable tax credit. We know that last year, 13 million Canadians provided $5 billion worth of health care to friends and family. And we identified that we thought they should get a tax break. So we costed that out, and we were able to present that in a targeted and strategic way. We also asked for expansion of community and home-based healthy and active living programs for seniors, specifically within the federal programs. Now, we've received some very positive feedback about the lobby, and some of it was reflected in the federal budget. Did we get everything we wanted? No. Are we finished the lobby? No. It's not a one-shot deal. It's just not a day in November where we go and with fingers crossed and hope that things happen. It's an ongoing pressure and lobby that happens, and our president, Karima Valji, describes it as relentless incrementalism, in that you realize that change most of the time is not monumental, but it's incremental. And you keep asking, and you keep presenting, and you keep talking about it. And we have the great advantage that the federal election will be coming soon. There'll be resources and toolkits on the CNA website for all the CNA members to be able to participate in the federal election campaign and talk about home is health. Amidst all that political work that we've been doing, CNA has been busy charting a new course for the next few years. And if you're like me and somebody mentions strategic planning and starts bringing out the flip charts and markers, all you want to do is run down the road screaming, because you've been involved in situations that relate to strategic planning that haven't necessarily gone past having a binder on the shelf. CNA took an approach where the strategic plan started with consultations and asking questions and talking to the public and talking to the members about what we should focus on, and realizing that we can't react to everything. We don't have the resources to be able to do that, and it's not wise to be reactive in many ways. So the target or the focus that CNA has chosen for the next 5 years for the strategic plan is primary health care. And primary health care is something that nurses understand. It's something that nurses do, and they realize that primary health care is not a site, it's not a building, it's not a program, but it's a way of being. And the way that we describe primary health care is the way that it was initially described in the Alma-Ata Conference in 1978. And as my colleague in Alberta, Shannon Spenceley, describes it, she says that primary health care is too important to be the flavor of the month. But primary health care is where the full scope of nursing practice meets the full scope of the human health experience, leaving no one behind. So this way of describing primary health care means that nurses in the operating room can see themselves in primary health care. Nurses on a surgical unit, nurses working in a well baby clinic, or providing rehabilitative care to individuals in homes, or working in long-term care. We landed on the areas of primary health care where we thought CNA could make a difference mobilizing their membership. And the three-pronged approach were, and you can see it on the slide there, advancing policy and advocacy efforts as part of the CNA work, building nursing capacity as it relates to primary health care, and leading a system shift, or as I like to describe it, turning the system on its head. And there will be strategies and descriptions of the work that CNA is going to be doing related to the strategic plan, and it will be, and in some of the issues already of the Canadian Nurse Journal, there's been articles written about that. So I encourage you to keep on top of that, and your president and president-elect will keep you informed as well about the way that CNA is going to work to make primary health care a focus for the next 5 years. This is another piece of CNA that is very important, is our membership. And part of my work, as I see it, is trying to make nurses see themselves in CNA. that CNA is just not something that's at 50 Driveway in Ottawa, but CNA is something that is integrated into the practice of registered nurses in Canada. And something in the year before that we developed the strategic plan, CNA went through a very involved process of changing the bylaws so that things could happen differently. And one of the things that will be happening differently in next week's annual meeting in Ottawa is, for the first time, the Canadian Network of Nursing Specialties will have votes at the annual meeting, which I think is very, very important. But also another very exciting thing, and the students will be glad to hear this, is that the 29,000 students in Canada will have involvement, the involvement through their Canadian Nursing Students Association. They will also have voting rights at the CNA annual meeting for the first time in history. And I think that will help move forward the CNA's work, as well as having now a class for membership for retired nurses and recognizing the value of that. This year, just to mention, CNA, and many of you may have had the opportunity to be certified through CNA's programs. Certification is a very important space that CNA occupies in nursing practice. And in 2014, 18,700 nurses earned their certification in one of the 20 nursing specialties. Another piece of work that CNA has done that I just want to let you know about was the increasing the scope of practice for registered nurses through RN prescribing, and recognizing that the jurisdictions and the colleges will have the final say in terms of how that unfolds across the country. But providing a national framework to start the thinking, or to provide a model for people to use when they're doing this work, is something that CNA has done. And if you're interested in that document, it is on the CNA website. And you'll notice the hostess with the mostess, your friend Arlene there with a lobster hat on, had the chance to invite everyone at the CNA Biennium in Winnipeg last year to come to St. John for the big celebration that will be happening next year. And I look forward to being there, and I know that it will be a wonderful, wonderful meeting. And as I mentioned, next week, CNA will be having their annual meeting in Ottawa. And if you're not able to come to that, it will be webcast, so you'll be able to listen in real time or listen to the recording. So we can't speak about CNA's success or NANB's achievements without talking about Roxanne Tarzan. And committed to advancing registered nursing in New Brunswick, Roxanne has a very long history in New Brunswick for working hard for nurses. And many of you may not know that Roxanne and I have actually been friends for 20 years. We were presidents at the CNA table together, looking at each other, wondering, okay, we kind of have to try to get through this as imposters for the first little while and try to convince people we actually know what we're doing. And if it hadn't been for Lucille Offrey, we probably would have been abysmal failures, but she kept us on track. And Roxanne and I have remained friends and colleagues for a very long time, and that's one of the reasons why I wanted to make the trip to New Brunswick to be able to honor her today. I know that nurses in New Brunswick have benefited from Roxanne's expertise through her tenure as she was a board member, she was a president, she's been your executive director for more than a decade, and she's also contributed to the national level. When you say Roxanne Tarzan's name at CNA House in Ottawa, people know that she's someone who has expertise, she can be counted on, and she's a very strong supporter and advocate for professional nursing. So one of the things, and I was trying to hide it here so Miss Snoopy Knickers over there wouldn't see it, but I did bring a very well-traveled gift. It's been to Ottawa, it's been to Canmore, and now it's back to Fredericton. But on behalf of CNA, I would like to present this small token of appreciation to my friend, colleague, and your leader, Roxanne. Good thing she's got Kleenex up here. So I want to thank you again for inviting me and letting me talk to you about CNA. And I know I've just kind of given you a real breeze through and just a real thumbnail sketch of the work that CNA is doing. I'd really be happy to speak to anyone today about that in more detail, have a chance to meet you and talk to you. And I want to leave you with some words of a very wise nurse who said, and I know that sometimes you think, you know, why am I even doing this? Why am I coming to this meeting? Why am I being involved in a professional association? It feels like I'm banging my head against the wall and nothing's changing. Just keep that thought of relentless incrementalism in your head. And remember the words of this nurse, you will have much opposition to encounter, but great works do not prosper without great opposition. And Florence Nightingale said that in 1894. Thank you. Merci.
Thank you.